This podcast is for informational purposes only and is not intended to diagnose, treat, cure, or prevent any disease. It should not be considered medical advice. Always consult with a qualified healthcare professional before starting or changing any health or wellness protocol. Let's talk about vasoactive intestinal peptide, better known as VIP. This small but powerful peptide plays an incredibly important role in the body. It's produced naturally in the gut, pancreas, and brain. It acts like a messenger, helping different systems communicate with each other. It's involved in regulating smooth muscle activity, blood flow, hormone secretion, and even immune system function. It was first identified in the early 1970s, and since then, researchers have continued to uncover how deeply it influences the human body. VIP is a neuropeptide, which means it has strong effects on the nervous system. One of its primary functions is to relax smooth muscle throughout the body. This can affect areas like the lungs, blood vessels, and gastrointestinal tract. When smooth muscle relaxes, it can help improve circulation, reduce constriction, and allow better oxygen and nutrient delivery. One of the most fascinating aspects of VIP is its impact on the lungs. VIP is a potent bronchodilator. That means it can help open airways, making breathing easier. This is particularly interesting when we look at conditions like asthma, chronic obstructive pulmonary disease, or other respiratory challenges. By relaxing the bronchial smooth muscles, VIP can help support airflow and oxygen exchange. VIP also plays a role in the cardiovascular system. It helps dilate blood vessels, which lowers vascular resistance and supports healthy blood pressure. This effect improves blood flow to tissues and organs, supporting overall circulation. It's not a stimulant like some other compounds. Instead, it works more subtly by encouraging smooth, natural vasodilation. Another area where VIP shines is in the gastrointestinal system. It regulates the secretion of water and electrolytes into the gut. This helps keep digestion balanced and can support proper intestinal motility. When VIP levels are dysregulated, it can lead to issues like malabsorption or diarrhea. But when balanced, it plays a key role in maintaining gut homeostasis. Beyond these functions, VIP is known for its anti-inflammatory properties. It can modulate the immune response, particularly by downregulating certain pro-inflammatory cytokines. In simpler terms, it helps calm inflammation in the body. This makes it an area of interest in autoimmune and inflammatory disorders. Researchers have also explored how VIP interacts with the hypothalamic pituitary axis, influencing hormone secretion. It can stimulate the release of prolactin, growth hormone, and other regulatory hormones. This broad spectrum of activity gives it potential therapeutic value across multiple systems. One of the more exciting developments around VIP is its potential role in treating chronic inflammatory response syndrome, sometimes known as CIRS. In these cases, patients may experience systemic inflammation triggered by environmental toxins or infections. VIP therapy has been studied as a way to help calm the immune response and restore balance. VIP also plays a key role in regulating circadian rhythm. The suprachiasmatic nucleus, the brain's master clock, relies on VIP to maintain proper timing and synchronization of daily rhythms. This means VIP is involved in sleep cycles, hormone release patterns, and even body temperature regulation. Disruptions in this system can contribute to fatigue, insomnia, or metabolic disturbances. Let's explore how VIP interacts with the immune system a bit more. It's known to act on T cells and macrophages, two critical players in immune defense. VIP can inhibit the production of pro-inflammatory molecules like TNF-alpha and interferon gamma. At the same time, it can enhance the production of anti-inflammatory mediators. This shift helps the body reduce unnecessary inflammation without shutting down immune defense completely. This makes VIP particularly interesting in autoimmune disorders. Conditions like rheumatoid arthritis, multiple sclerosis, and inflammatory bowel diseases involve overactive immune responses. VIP may offer a way to modulate those responses without the broad immunosuppressive effects of some medications. Another emerging area of research involves VIP and the brain. VIP receptors are found throughout the central nervous system, especially in regions involved in memory, emotion, and stress regulation. VIP helps regulate neurotransmitter activity, which may influence mood, anxiety levels, and cognitive clarity. Early studies suggest VIP may support neuroprotection by reducing neuroinflammation and oxidative stress. In clinical research, VIP has been explored for its potential benefits in people with chronic fatigue syndrome, post-viral syndromes, mold illness, and other conditions where inflammation and immune dysregulation are at play. In these scenarios, VIP may help restore normal signaling and support balance between different body systems. VIP's role in the gut-brain axis is also gaining attention. Because it's produced in both the gut and the brain, it can influence communication between these two systems. It can affect how the gut responds to stress and how the brain processes gut-derived signals. This relationship plays a big role in mood, digestion, and overall resilience to stress. Now, let's talk about its receptors. VIP primarily binds to VPAC1 and VPAC2 receptors. These receptors are widely distributed throughout the body, including the lungs, heart, gastrointestinal tract, brain, and immune cells. When VIP binds to these receptors, it activates pathways that increase cyclic AMP levels inside cells. This leads to smooth muscle relaxation, anti-inflammatory effects, and improved cellular signaling. VIP has a short half-life in the body, which means it breaks down quickly. For therapeutic use, synthetic versions of VIP or VIP analogs have been developed to extend its activity. These analogs can provide more sustained effects, making them more practical in certain clinical settings. One area that has sparked a lot of interest is VIP's potential use in post-infectious syndromes. Some individuals experience lingering inflammation, dysautonomia, or breathing difficulties long after an infection. Because VIP can improve circulation, reduce inflammation, and support airway dilation, it's being explored as part of recovery protocols. There are also studies examining how VIP may influence mitochondrial function. By improving oxygen delivery and reducing inflammatory stress, VIP can indirectly support energy production at the cellular level. This can have wide-reaching benefits for people dealing with fatigue or reduced physical endurance. It's important to note that VIP is not a stimulant. It doesn't force the body into a state of overdrive. Instead, it supports balance, helping different systems regulate themselves more effectively. This makes it appealing for those seeking gentle, systemic support rather than a quick, harsh push. Because VIP affects blood flow and airway dilation, some individuals may experience sensations like warmth or improved breathing after administration. These effects are typically mild and related to the vasodilation process. As with any bioactive compound, safety and proper use are critical. VIP can influence blood pressure, heart rate, and immune activity, so dosing must be individualized and carefully monitored. It's also important to work with a qualified medical professional, especially if underlying health conditions are present. VIP's connection to brain health is another exciting frontier. In neurodegenerative conditions where inflammation and oxidative stress play a major role, VIP may offer protective effects. It can reduce inflammatory signaling in the brain and help maintain blood flow, both of which support cognitive function. Research has also suggested VIP may help support endothelial health. The endothelium is the thin layer of cells that line blood vessels. By improving endothelial function, VIP can support vascular flexibility, circulation, and oxygen delivery throughout the body. One particularly fascinating angle is the relationship between VIP and nitric oxide. While they're distinct pathways, they can work synergistically to enhance vasodilation and circulation. This means VIP could support healthy nitric oxide signaling without relying on the same mechanisms as other vasodilators. VIP also plays a part in pancreatic function. It can stimulate insulin secretion in certain contexts, which has implications for glucose metabolism. While it's not a primary regulator of blood sugar, this influence adds another layer to its systemic effects. In the gut, VIP supports the secretion of water and electrolytes. This may sound small, but it's vital for proper digestion and nutrient absorption. It also helps maintain mucosal health, protecting the lining of the gastrointestinal tract from damage. When VIP signaling is disrupted, the effects can be widespread. It may contribute to gut dysmotility, inflammatory states, poor circulation, sleep disruption, or respiratory issues. This interconnectedness is part of why VIP therapy is being researched for a range of chronic conditions. Because VIP is naturally present in the body, synthetic forms aim to mimic its normal physiological effects rather than override them. The goal is to restore balance where dysfunction exists. VIP may also influence the lymphatic system, supporting fluid balance and immune transport. This adds another layer to its circulation-supporting effects. Some research has explored VIP in relation to pulmonary arterial hypertension, a condition where blood pressure in the lungs becomes elevated. VIP's ability to relax pulmonary vessels and improve oxygenation may offer therapeutic potential in this area. Another area of interest is its effect on neuroendocrine regulation. VIP interacts with pituitary signaling and may help fine-tune hormone rhythms. Because of this, it can influence everything from sleep-wake cycles to energy metabolism. Its influence on circadian rhythm cannot be overstated. VIP is a key signaling molecule in the brain's master clock. Disruptions in VIP signaling have been linked to sleep disturbances, mood imbalances, and metabolic dysregulation. Supporting VIP levels may help restore more natural daily rhythms. VIP is also being studied for its role in protecting the blood-brain barrier. This protective layer separates circulating blood from the brain's delicate environment. Inflammation and stress can compromise it, allowing unwanted molecules to pass through. VIP may help preserve its integrity, supporting overall brain health. Because of its broad activity, VIP is sometimes called a master regulator peptide. It doesn't just affect one organ or pathway. It works across multiple systems to support balance and communication. In practical use, people exploring VIP therapy may notice gradual changes rather than instant effects. Improved breathing, more stable energy, better sleep patterns, and reduced inflammation are commonly reported over time. It's important to emphasize again that this is a powerful regulatory peptide, and its use should be guided by a professional who understands its mechanisms. As research evolves, VIP is gaining more attention, not just for acute conditions, but also for chronic wellness strategies. Its ability to promote vasodilation, support immune modulation, protect brain function, and regulate circadian rhythm makes it unique. Some scientists are exploring how VIP analogs might be used in combination with other peptides or therapies to enhance outcomes. Because it works on such a foundational level, it may complement other treatments well. Like any emerging therapy, clinical research is ongoing. While results are promising in many areas, more large-scale studies are needed to fully understand its long-term effects and optimal applications. VIP's story is a perfect example of how something naturally produced in the body can be harnessed for therapeutic purposes. It bridges the nervous system, immune system, vascular system, and more. As the science progresses, we're likely to see more refined delivery methods, improved stability, and even targeted applications of VIP-based therapies. This could expand its use in respiratory health, immune balance, brain protection, and systemic regulation. This information is for educational purposes only and should not be taken as medical advice. Anyone considering peptide therapy should always work with a licensed healthcare provider. Thanks for listening, keep learning, and stay curious.